Well, the thyroid gland is one of our largest and most important endocrine glands in the body. Endocrine means producing hormones. It doesn't produce a juice like the pancreas or the salivary glands, it produces hormones. The thyroid gland regulates this way most of the pace of the body, the rate the body works. So if the thyroid gland produces hormones, this will delineate the growth and the function of the body. Yes, the thyroid is investigated by different techniques. Of course, first of all is a clinical examination. But most importantly, we have a function test for the thyroid, which is a blood investigation. We call it thyroid function test. So we check the hormones, the level of the hormones in the blood, mainly the T3, the T4, and the TSH. But also the thyroid is investigated by ultrasound. So many years ago, the thyroid was mainly investigated by scintigram. Nowadays, ultrasound is the gold standard as a first investigation for the thyroid gland. The most common thyroid disorders are functional disorders. So the hormones can be either too high in the blood or too low. This has an impact on the well-being. So if the thyroid hormones are high, we call it hyperfunction or hyperthyroidism. Means the body is running fast. The heart rate is fast. The persons might sweat. They suffer of diarrhea and many other symptoms. If the hormones are low, we call it hypofunction, hypothyroidism. It's just the opposite. So the body becomes lazy. People tend to sleep a lot. They gain weight. They might have edema. So many of the organ functions are slowed down. Thyroid surgery, luckily, is an exception. Most of the thyroid diseases can be treated conservatively, but there are typical diseases which require surgery. So if the gland becomes very big, we call it a goiter, enlargement of the thyroid, then this goiter can cause compression symptoms in the neck. It can compress important organs in the neck like the esophagus, which is the swallowing organ, so people cannot swallow properly, or the trachea, which is the windpipe, and people have difficulties to breathe. It can also compress the nerves, mainly the vocal cord nerves, the recurrent laryngeal nerve, and this will cause hoarseness of the voice. And it can cause compression on other nerves with consecutive pain in the neck. Once we do thyroid surgery, we have the common risk as in every surgery, which is infection and bleeding, but there are two specific risks in thyroid surgery, specifically if you do total thyroidectomy, the removal of the entire gland, which are the damage of the recurrent laryngeal nerves, again the voice, and the damage to parathyroid glands. The parathyroid glands are 4 small little organs behind the thyroid, not directly related to the thyroid, and they produce a complete different hormone, which is the PTH. Those organs are responsible for the metabolism and the regulation of the calcium and the phosphorus in the blood. In most of the cases, thyroid surgery means removal of a part of the thyroid. Unless it is malignant, means cancer, where total thyroidectomy is required. In all other cases, a part of the thyroid could be preserved, so there will be no big difference from the situation before surgery. But once you removed a major part of the thyroid or the total thyroid, replacement therapy is needed. So you have to give supplements, basically substitution of the hormones produced by the thyroid, which is normally called thyroxine, T4.